Ladies and gentlemen, I'm very happy to present our research on anorectal musculature in normal newborn babies and anorectal malformations. My talk will include the following points. First, the normal and abnormal anorectal musculature surrounding the anal region, and anorectal musculature and the surgical approaches for the ARM. In normal, according to our study, the musculature in anal region consists of the three muscular tubes. From inside to outside, they are internal anal sphincter muscular tube, the longitudinal muscle tube, which consists of the longitudinal muscle of the rectum, the longitudinal muscle from the levator ani. They are joined together to end at the perianal skin, and the transverse muscle tube, which consists of the puborectalis and the external anal sphincter. In the magnified view, this is the anal canal. This is the internal anal sphincter, which comes from the circular muscle of the rectum. In the anal canal region, the circular muscle become hypertrophic and thick. This is the longitudinal muscle of the rectum. This comes from the smooth muscle of the rectum. And this is the levator ani, the longitudinal fiber from the striated muscle of the levator going to join with the longitudinal muscle of the smooth rectal muscle. They join together and ended at the epidermic of this perianal skin. This is the puborectalis, and this is the external anal sphincter. You can see it is clearly demonstrated. There are three muscular tubes in the anal region. This is slide 3 millimeters away from the middle line. You can see this the pubis, this the puborectalis muscle. This is the longitudinal muscle fibers ended at the perianal skin. This is the external anal sphincter, the longitudinal muscle fibers surrounded by the transverse striated muscle. So in the perianal skin, you can see the longitudinal muscle ended at the epidermal layer of the perianal skin. The end of the longitudinal muscle fiber, you can see there are plenty of the sensory nerve ending. So in summary, in normal, three muscular tubes in the anal region. From inside to outside, there are internal anal sphincter muscle tube, the longitudinal muscle tube, which consists of the rectal smooth muscle and the levator striated muscle, the transverse muscle tube, which consists of the puborectalis and the external anal sphincter. And this slide shows the musculature in the anal region in the rectal bladder neck fistula of ARM. You can see this is the posterior urethra, bulbar urethra, the rectal port located above the levator. The longitudinal muscle from the levator displaced upward and anteriorly to the posterior urethra, and it consists of the two parts, the pelvic longitudinal muscle and the perineal longitudinal muscle in high ARM. In summary, in high ARM, only 1.5 muscular tube existed. The internal anal sphincter muscle tube is absent. The rectal longitudinal muscle tube is absent. The pelvic longitudinal muscle tube displaced anteriorly and upward to the posterior urethra, and the perineal longitudinal muscle tube closed, and the transverse muscle tube is narrowed. This slide is showing the musculature in the rectal bulbar fistula. You can see this is the rectal pouch. This is the fistula. The pelvic longitudinal muscle tube is opened by the dilated rectal pouch, and the perineal longitudinal muscle tube is closed. In intermediate ARM, only 1.5 muscular tube existed. The internal anal sphincter muscle tube is absent. Rectal longitudinal muscle tube is absent. The pelvic longitudinal muscle tube is opened by the rectal pouch, and the perineal longitudinal muscle tube is closed, and transverse muscle tube above part corresponds to the puborectalis is opened, and the external anal sphincter muscle tube is narrow. This slide showing the rectal vesical fistula. You see the dilated rectal pouch, and this is the longitudinal muscle tube closed and displaced anteriorly to the posterior urethra. In the magnified view, in the external anal sphincter, a lot of the fat tissue exists in the external anal sphincter. This is a sign of agenesis of the external anal sphincter in ARM. According to our study, the length of the puborectalis in neonates about 2.29 centimeters. However, in high ARM, it is 1.41 centimeter. It's significantly shorter than the normal in the length of puborectalis. In the intermediate ARM, the length of the puborectalis about 2.2 centimeter. The length of the longitudinal muscle tube in normal about 1.79 centimeter. However, in high ARM, the length of longitudinal muscle tube is 2.66. It's significantly longer than the normal. And the length of the longitudinal muscle tube in intermediate ARM is about 2.33. The length of the perineal longitudinal muscle tube in normal about 0.97 centimeter. It's significantly shorter than that in high ARM. It is about 2.7 centimeter in high ARM. So in high ARM, it's clear demonstrated in our study. The length of the puborectalis becomes shorter, and the length of the longitudinal muscle tube becomes longer in high ARM than normal and than the intermediate ARM. And next, I'm going to talk about our study on sensory neuroinnervation in anal region. This slide shows the innervation in the dentate line area of normal neonates. You can see plenty of the free nerve endings in the anorectal mucosa. This is internal anal sphincter muscle tube. This is the external anal sphincter muscle tube. This area is the longitudinal muscle tube. You can see inside the longitudinal muscle tube, you can see this is the passing corpuscle in the this area. This is the receptor to create the ball sensation in brain if the internal anal sphincter relax or stool in the anal canal. So according to our study, we found plenty of the passing corpuscles located in the longitudinal muscle tube. This slide shows the normal newborns in the puborectalis and the external anal sphincter. there are a lot of the muscle spindles in this area of muscles. You can see there are 3 muscle spindles located side by side in the puborectalis. This is the muscle spindle in the external anal sphincters. On the magnified view, you can see the muscle spindle in the puborectalis or the external anal sphincter. It's very complex in structure. This is the sphincter to sensate anal sensation when the stools inside the anal canal or the rectum. However, in the ARM, you can see this is the muscle spindle in the puborectalis of the high ARM. You can see it's become swollen, and the diameter is larger than the muscle spindle in the normal. According to our study, we see in normal the muscle spindle located in the anterior 2/3 of the puborectalis. This is the side view of the puborectalis, the side view of the external anal sphincter. In normal, there are plenty of the muscle spindles located in the middle portion of the external anal sphincters. This side view of the puborectalis, you can see in high ARM, the muscle spindle mainly located in the middle third of the puborectalis, and then in intermediate ARM, the muscle spindle also located in the middle portion of the puborectalis. And then we also investigated the density of the muscle spindle both in normal and in ARM. It was found the density in puborectalis in high ARM about 0.65, intermediate about 0.73. However, in normal, the density about 1.96. So the density of muscle spindle in high and intermediate ARM is significantly lower than the normal. We also made a study on the motor neuron or morphology on the sacrospinal cord, both in normal and ARM. This is a slide showing the sacrospinal cord of the normal newborns. And this is a ventral part. It's a dorsal part. You can see the central tube here. This is the ventral anterior motor neuron in the sacrospinal cord. This slide shows the sacrospinal cord in ARM. You can see this is the sacrospinal cord showing the disappearance of the central tube. And this slide shows the segmented central tube. This slide shows the dilated central tube in ARM. And besides, you can see the number of the motor neuron in the sacrospinal cord in high and intermediate ARM is significantly fewer than the control and the low type of anorectal malformations. This means the ARM is not only the absence of the anus and the agenesis of the perianal musculature, but also the pathology includes the agenesis of the sensory and the motor innervation in the pelvic and the anal region. And next, I'm going to talk about the musculature and the surgical approaches for ARM. Approaches for tunnel formation in the sphincter muscle complex center in ARM is most important for the anorectoplasty. The first very important thing is to locate the center of the sphincter muscle complex. According to our study, it's demonstrated that the longitudinal muscle tube from the levator ani is the center of the sphincter muscle complex. For the surgery, it needs to be split or divided to open, either by the PSAP or by the LAP approaches. We developed the trans-longitudinal muscle tube approach for pelvic and perineal tunnel dilators. From the pelvic approach under the laparoscope, the pelvic tunnel was dilated by the dilator. For the perineal longitudinal muscle tube tunnel formation, it is a developed perineal approach. For the perineal longitudinal muscle tube tunnel formation, we prefer to use curved and scaled Kelly clamp. Under the electric stimulation, the center of the longitudinal muscle tube was decided, and the clamp was used to develop the longitudinal muscle tube from the perineal approach. And then under the laparoscope, the tunnel was connected with the pelvic longitudinal muscle tube. Approaches for the pelvic longitudinal muscle tube tunnel formation in high ARM, we use the adjustable curved dilator. After closure of the rectal urethral fistula, the dilator was introduced from the umbilical foci, and the tunnel was developed along the posterior urethra. And then from the perineal side, the perineal longitudinal tunnel developed and progressed to the pelvic longitudinal muscle tunnel. In conclusion, according to our study, it's clearly demonstrated there are three muscular tubes in the anal region in normal. They are internal anal sphincter muscle tube, the longitudinal muscle tube, which come from the longitudinal muscle of the rectum, and the longitudinal muscle tube from the levator ani, and the transverse muscle tube. In ARM, only 1.5 muscular tube present. The internal anal sphincter muscle tube is absent. Rectal longitudinal muscle tube is absent. Pelvic longitudinal tube exists but narrow and displaced anteriorly. The transverse muscle tube is shrink. The longitudinal tube in ARM is the center of the sphincter muscle complex, where the new rectum should pull through from this longitudinal muscle tube. The trans-longitudinal muscle tube approach for tunnel formation can be fulfilled by the combination of the perineal and the pelvic route. Thank you for your attention.